You're welcome to my channel. Thanks for visiting. Today is all about Nystatin. Specifically, I'll be going through oral Nystatin. Without further ado, let's go. Nystatin is an antifungal agent. Nystatin could be under different brand names. There are a lot of them. Just find out which one is the brand name in your country or jurisdiction. If someone is on dialysis, specifically peritoneal dialysis, and he or she is on antibiotics, then we'll be giving Nystatin or per oral to prevent secondary fungal infection that could lead to peritonitis. While on that antibiotics, and we planned giving Nystatin, Nystatin should be given at the same time that the individual is on antibiotics. We'll continue Nystatin daily when the individual is on antibiotics daily. But we're going to stop giving Nystatin under different conditions at different days. If the specific antibiotics is gentamicin or any of the aminoglycosides, the Nystatin will continue while the individual is on the aminoglycoside, but we will only stop Nystatin 3 days after the stoppage of the antibiotics, unlike the rest antibiotics. But another exceptional case is also when the choice of antibiotics is vancomycin. So if the individual is on vancomycin while on peritoneal dialysis and we want secondary fungal infection prevention, then we will not stop on the day that the vancomycin is stopped. We'll continue giving Nystatin until 7 days after vancomycin has been stopped. Let me recap. Peritoneal dialysis, the individual is on antibiotics, right? We'll be giving Nystatin every day as long as the individual is on antibiotics. When antibiotics stops, we'll stop Nystatin. Okay, but if the individual is on aminoglycoside, then we will not stop on the day the antibiotic stops. We'll continue until 3 days after the aminoglycoside had been stopped. Also, if the individual is on vancomycin as the choice of our antibiotics, we'll continue giving Nystatin even when we have stopped giving vancomycin for the next 7 days after vancomycin had been stopped. Another fact about Nystatin is when it is swallowed, there will be less systemic absorption. So, we will expect Nystatin to be excreted via feces, and it will appear unchanged because of less systemic absorption. That is another fact about Nystatin. Another fact is in pediatric age group, the dose that will be required is between 200 international units to 600 units. In fact, in premature individuals or neonates, we can go as low as 100,000 units. These will be divided into 2 equally, and a portion will be given to each side of the mouth. In renal or hepatic failure, there will be less effect on the dosage of Nystatin. Okay, let's examine another fact that is about the mechanism of action of nystatin. It is meant to disrupt the cell wall of the fungus, and this will be done by binding to the steroids in the fungal cell membrane. When that happens, there will be increase in the permeability of the cell wall, and that will lead to leakage of the contents of the cell and subsequent death. Contraindication. The only contraindication is hypersensitivity to nystatin or any component of its formulation. The adverse effects will include hypersensitivity. In this case, there may be swelling, rashes, even toxic epidermal necrolysis or Stevens-Johnson syndrome, and all these could be deadly. Also, there might be gastrointestinal tract affectation where the individual can have nausea, vomiting, or even diarrhea. Still on adverse effects, the cardiovascular system could be affected in such a way that the heart rate will rise, tachycardia. Musculoskeletal system could give us muscle pain, known as myalgia. One, there might be a hypersensitivity reaction. I've gone through that just a while ago, but let's have a recap here. An individual could become sensitive to nystatin. We will stop the medication immediately because there will be swelling, urticaria, breathing difficulty, bronchospasm, toxic epidermal necrolysis, Stevens-Johnson syndrome, all could appear. We'll grab our EpiPen, hydrocortisone, Benadryl, bronchodilators, then get our IV fluid and involve appropriate units. Toxicity may be devastating, particularly in younger age group, either premature individuals or the neonates. If the formulation contains propylene glycol, there may be respiratory or even renal failure. The neonate could develop seizures, and metabolic lactic acidosis could all occur, so could lead to death. Please use nystatin as being prescribed. Particularly in the case of topical nystatin, don't use it per oral, and you don't use it in certain parts of the body. I'll go into that while addressing topical nystatin. There's likelihood of irritation of the skin. If that occurs, we got to stop. Let's go through the uses of oral nystatin. In the treatment of candidiasis generally, that is why we use it the most. But we can also use it prophylactically to prevent peritonitis as a result of secondary fungal infection in anyone on peritoneal dialysis taking antibiotics. I've explained a while ago, but let me explain further here why that is the case. Someone is on peritoneal dialysis and is on antibiotics. The antibiotics will wipe off the normal flora. In that case, there will be good breeding ground for the fungus. So the experts have chosen not to allow the fungus to thrive by giving both the antibiotics and antifungal agent nystatin at the same time. The same is, what is expected when anyone is on percutaneous endoscopy gastrostomy. So For fungi prevention, prophylactically, we use Nystatin. For candidiasis treatment, we use oral Nystatin. Nystatin per could come in form of tablet or lozenges for per use, and then we can just pick example of the generic form of that. That will be 500,000 units per tablet or lozenge. It could be in powder form. In that case, this fraction of teaspoon will contain 500,000 units also. And it could be in form of suspension for per oral use. And in that case, a ml will contain 100,000 units of Nystatin. How do we administer Nystatin? We'll go for 500,000 units for adults. The individual is expected to switch this in the mouth, keep it there for a very long time, as long as possible, and then gargle and swallow. We will do this 4 times a day. Some will choose 3 times. It depends on the severity of the candidiasis. Then you do that for 7 to 14 days. But in many cases, it is not just straightforward like that, because we are treating human being, right? Until 2 days, when the symptom would have disappeared, or after you swab the region again and the candida albicans are no longer found, so swab negative. So either 7 days or 14 days, but the infection must have disappeared and the swab must be negative before we can stop the use of Nystatin in handling candidiasis. Still on administration, let me explain a little further. The lozenges form, you can have 1 or 2 lozenges and hold that in your mouth. Please don't chew. Don't swallow immediately. So hold it in your mouth, let it dissolve right there. And then maybe use your tongue to swag and swash, and squeeze round. You can swallow the dissolved content with the saliva in your mouth after. Okay? And that could be Nystatin that will come in tablets coated, and so on. So there is only Nystatin with lidocaine. In the case of suspension form, your physician will prescribe the appropriate amount necessary based on what he or she is handling at the moment. So it might be 4 to 6 ml or 1 teaspoonful, 3 or 4 times daily. But in the case of children that are old enough, it can be about 2 ml, while the younger kids could have only 1 ml, about 3 to 4 times daily. The powder form, take 1/8 of teaspoon, then you pour that in water. Some will say a glassful, some will say 4 ounces, mix thoroughly. You can do something different. In this case, you can divide the content into smaller portions, but you got to take the portions within the same time, not too far apart, because I'm going to do that 3 or 4 times daily. So when you divide into smaller portions, you put the first portion in the mouth, squeeze there, hold it for some time and swallow. Don't spit out. You take the second portion and do the same. In pediatric age group, we are not going for 500,000 units. will be going between 200 and 600,000 units. But remember, I have just said that in low birth weight or premature human beings will go as low as 100,000 units. So what we do for younger kids is that we won't go too high, just about 200 units, and we will even divide this into two equal portions. What we do with the first half is to put at one side of the mouth and the second half at the other side of the mouth. The older kids could take higher dose of 400 to 600,000 units. We will do this 4 times a day for 7 to 14 days, and it must be after 2 days of relief, complete relief from the trouble, or when the swab is negative for Candida albicans, or both. Let me explain what I meant by both. Even when we have given this for 7 or 14 days, there must be no signs or symptoms of the candidiasis anymore, and we will swab again. It must be negative for Candida albicans. Then we are done. In pregnancy or breastfeeding mother, to be at safer end, just discuss with a pharmacist or OBGYN specialist in your jurisdiction or follow the protocol. But there is no record that shows that it is dangerous. However, if you can't contact any of this on time and you still want to handle it, well, you can, since there's no record that it is risky and there's no record that it's 100% safe, then I would rather go for less dose and reduce the frequency. And at the same time, working on getting a pharmacist or OBGYN specialist. For drug-drug interaction, I would rather leave that to the pharmacist or clinical pharmacologist. Please contact them because the list might be long, and I cannot say precisely what you might be taking that will affect your life when you take it with Nystatin. In conclusion, please say no to self-medication. The fact that I have put all these facts here when it comes to Nystatin is not the license for anyone to use my presentation for self-medication. Please contact your physician for all your medical needs. Stay healthy, please. Thanks for listening. Please remember to share this. Remember to subscribe to my channel. I appreciate it.